I'm Philippa Wood. I'm a paediatric registrar working in South East Scotland in the UK. In our area, around 30% of children are overweight or obese. We would probably all agree that this situation needs urgent action, but as clinicians, how many of us actually consider it on a day-to-day basis? At our general paediatric outpatient clinic, we already routinely weigh and measure every child who attends, which is not otherwise something that happens to children in this area very often. As such, we have a fairly unique opportunity to calculate their BMI and to open discussions with families if there is any concern. I would even argue that if we weigh the child and don't mention our concern, then the family might quite reasonably assume that everything is okay. When we looked at the notes from our outpatient clinic, 54 children, that's 24% of all attending, were overweight or obese. Looking at the notes for these children, only 20% had acknowledged that the clinician had realised there was a raised BMI, and only 17% had had any documentation of advice given or referrals made. To improve our performance, our overall strategies were firstly to make it easier for the clinician to recognise a raised BMI, and secondly, to empower the clinicians to open discussions with families and follow a clear referral pathway. Firstly, we trained the clinic staff, who were already trained in plotting weight and height centiles on these growth charts, to use the lookup tool on the back of the UK standard growth charts in order to obtain a BMI centile. This is really quick to do and involves no calculations, simply plotting one extra point using the centiles already obtained. We then procured a new rubber stamp for the clinical notes, with a space for BMI alongside all the other clinical measurements. An educational meeting was held for our clinician colleagues, partly to explain our project and partly to share some communication skills training in order to help them to raise what can sometimes feel like a fairly difficult issue to talk about with parents. Having implemented these changes, rates of recognition of raised BMI increased from 20% to 31%. Documentation of discussion or referral had more than doubled from 13% to 27%. We have shown that a few small changes can have a significant effect on the number of families being offered advice on this important subject.